As I record this, the case rates of COVID infection in Torbay are among some of the highest in the country. We've seen increases over the last few weeks, particularly in school-aged populations. Our peak age group is 10 to 14. And outside of the school-age population, we're seeing another peak of adults between 30 to 39 and 40 to 49 years of age. And these are probably the parents and staff of children in that school-age population. Our aim in schools is to reduce the disruption to education as much as possible while keeping our school population safe. One of the key pillars of doing that is the school's testing program. And it's important that students and staff not only test regularly, but that they also report those results, even when those results are negative. The other thing that we've been working with schools on is to find sensible and proportionate ways of having those school events that are such a feature of the Christmas season in safe ways that reduce the risk by bringing together large groups of people unnecessarily. And as you discuss with your schools, you will find what arrangements are in place to have those events in a safe way, recognizing the increase in the background rates. The COVID vaccine program has made a huge difference in this pandemic, in that it's broken the link between infections and severe disease. So although our background rates are high, over 600 new cases per 100,000 population, we have not seen that translate into the kinds of hospitalizations and deaths that we saw in the first two waves of the pandemic. It's important, therefore, that anyone who's not had a first or second dose of the COVID vaccination should do so as soon as possible. And there will be information on Torbay Council's website about the different opportunities that we're making available for people to have their first and second doses. Immunity to COVID does wane over time. And this is whether one's had the infection itself or whether you've been vaccinated. And therefore, booster jabs become really important as we go into the winter months to prevent any rebound in cases, particularly among older populations who are more vulnerable to severe disease without that immune protection. Booster jabs are now available for those who are over 40 and also those who have underlying health conditions. In addition to having vaccinations, and I will include the flu jab here because we want protection from all infections that might circulate more freely during the colder months of winter. It's important to remember that hand hygiene continues to be important to reduce spread, that wearing a face mask or face covering, particularly in crowded and indoor spaces, is another important measure. Maintaining space, keeping social distance, particularly from people who are not part of our household or part of our regular social groups, and also maintaining ventilation as much as possible. When we are in closed rooms, the particles of virus can build up in the atmosphere over time. And so periodically opening windows, even 10 to 15 minutes each hour, can help if we're not able to keep free circulation going through those rooms. Working together, taking responsible actions can help us to reduce the risk to ourselves and to others. We know that 1 in 3 people can have COVID without knowing it and can transmit it to others because they're asymptomatic. And so it's important that we continue to test regularly, to take those actions that reduce risk to ourselves and others when we are mixing in large groups, and to continue to act responsibly so that we can ensure that there is no additional pressure on the NHS as we go into these colder months where we know that infections typically circulate. We want to do everything that we can to protect ourselves and others and the residents of Torbay. Thank you.